Hello, I'm Dr. Cheryl Clark, the founder of the Center for Aesthetic and Preventative Dermatology at East 61st Street and Park Avenue in Manhattan. I'd like to offer today 5 questions you might want to ask your doctor before deciding to proceed with botulinum toxin A injections in that practice. And by botulinum toxin A, I am of course referring to Botox as well as Xeomin and Dysport, but for the purposes of this discussion, I'll use the term Botox to refer to all 3. Question number 1. Are you board certified in dermatology or plastic surgery? This is very important because it requires board certification to learn the anatomy and physiology of the facial musculature in order to give a good result and avoid serious side effects. Question number 2. Can you inject Botox in such a way that I get a nice shape to my brows and maybe even a nice lift and a little curve? I've shown here one pattern I might like to use in a woman who is having her frown lines injected. I like to inject the lateral and medial corrugators, which are the muscles that go across the brow towards the midline, the large procerus muscle at the bridge of the nose, as well as the tiny depressor supercilii muscle on either side of the bridge of the nose. In addition, I like to put a little bit in the lateral fibers of the periorbital muscle. This pattern allows a subtle lift all the way across the brow while maintaining a very natural and normal looking curve. Question number 3. Can you prevent me from getting that horrible quizzical brow, that upside down V near the end of the brow that looks like Jack Nicholson in The Joker? So some people have a very strong segment of the forehead muscle, which we call the frontalis muscle, and that lateral segment, if it's strong above the temples, can allow the brows to be drawn up to an extreme after the frown lines are injected. Your doctor should be able to examine you to see if you have this strong component and treat it with a tiny amount of Botox to prevent that from happening, both in that upper forehead as well as under the lateral aspect of the eyebrow. So you still get a nice lift to the brow without it being peaked. Question number 4. How can you prevent side effects like my eyelids drooping over my pupil or my eyebrows drooping over my eyes and being flat and giving me a hooded upper eyelid? There is a little canal just above the middle of the pupil at the middle of the brow. So we try to avoid injecting exactly in this location to prevent the Botox from migrating down to the molars muscle, which is responsible for lifting up the eyelid over the pupil. Another nice way to prevent this is to hold the thumb firmly under the eyebrow against the bone while injecting. You can get an eyebrow droop through several means. You should understand that the muscles that cause your frown lines, which we call the glabellar complex, pull the eyebrows together and down, and the muscle that raises your brow, which we call the frontalis muscle, are above these muscles, and they interdigitate with each other. So if you relax the frontalis muscle at the same time as relaxing the glabellar muscles, the frontalis muscle relaxes very quickly and you can temporarily get a flat, dropped brow. So I would suggest, if you want to treat both areas, if you want to treat both frown lines and the lines that go horizontally across your forehead, that you first have the frown lines treated and then return a week or 2 later and have Botox or Dysport or Xeomin placed only exactly where you need it in the forehead. This will save you from getting a dropped brow, and it will be probably fewer units, so it'll save you a little money as well. Another way you can get a dropped brow is if the injections are placed too high, just above the glabellar complex. You can hit the fibers of the frontalis muscle this way, and that will drop the brow, so the injection should stay low. Lastly, if you only want to have the forehead muscle treated, if you only want to treat those horizontal furrows, It really should be placed fairly high so that you don't get a dropped brow. That lower portion of the frontalis muscle will still be active and will still be drawing your brow up. So you can have the Botox placed high in a small number of units and then come back a week or two later and have it touched up with just a tiny bit more if it's still necessary. Question number 5. How do I know I'm being treated with Botox? Yes, there are counterfeits out there. It's terrible. And you should want to know the answer to this question. This is a picture of the 3 vials of the botulinum toxin A that we use, Botox, Xeomin, and Dysport. The Botox vial even has a little hologram, which is difficult to see, but if you look at the bottle and turn it around, you'll see the word Allergan faintly in the hologram on the bottle. So those are 5 questions you might want to ask to make sure that you are comfortable and that you'll get a great result without serious side effects. I hope this has been helpful. Thank you.